A very good morning to you, dear listener, and welcome to Perspectives, a current affairs discussion program on Agate Radio 95.5 Star FM, Makurdi, Benue State. Today's edition of Perspectives is focused on sensitization on healthy living, and it is an edition sponsored by the Association of Resident Doctors at the Federal Medical Center, Makurdi, Benue State, as part of their corporate social responsibility, because that health is wealth, is nation, it is said, is a worthy nation. That is why on this edition, the Association of Resident Doctors at the Federal Medical Center, Makurdi, have chosen to sponsor this edition to sensitize the public on basic healthy tips, cutting across diverse issues and medical conditions that the people need to be aware of so that we can sustain a healthy society in our families and our homes to enjoy the benefit of living. I have been joined here in the studio by three seasoned medical experts who will share thoughts with us on this subject matter. First, I'd like to welcome a senior registrar in Family Medicine Department. He is also the President, Association of Resident Doctors at the Federal Medical Center, currently the Deputy Caucus Leader of the North Central Caucus of the Nigerian Association of Resident Doctors. Dr. Fanen Dogoh is our guest on Perspectives this morning. Good medicine at the Federal Medical Center, Dr. Tesu Apande. Welcome to Perspectives, Dr. Apande.
Thank you for having me.
And of course, we have a registrar in Obstetrics and Gynaecology at the Federal Medical Center, Makurdi. She is a member of the Association of Resident Doctors at that hospital, Dr. Esther Gbayan. Good to have you join us, Dr. Gbayan.
Thank you for having me.
I am Nathaniel Nongu, welcoming you to this Wednesday edition of the program. And if this is your first time, cast every Monday, Wednesday, and Friday between 9 and 11 a.m. And at 10 o'clock, we allow you, the listener, to also participate on the program. And you can do so later at 10 o'clock today to be a part of the discussion. And let's avail you some of the platforms through which you can reach us. All right, welcome back from that short break. And if you are just tuning in, the program is Perspectives, as we mentioned. The platforms through which you can reach us on the studio line is 0814-335-9292. 0814-335-9292. And you can also send us an SMS or a chat on WhatsApp to the number 0912-699-9404. 0912-699-9404. You may log on to our website on www.agateradio.tv.com to listen to us and access other content of Agate Radio as well. You can follow our social media pages or download the Agate Radio and TV app from Google Play Store, which avails you the platforms through which you can also be a part of the program. I'd like to begin with you, Dr. Dogoh, as we move into the discussion. I will start with a segment of general health. Kindly speak to us, what are some simple lifestyle changes that can significantly improve overall health and well-being?
Okay, thank you once again, Mr. Nathaniel, and our listeners for the opportunity to interact this morning. Like you rightly introduced, this program has been put together by the Association of Resident Doctors at the Federal Medical Center in Makurdi here, sponsored also by one of our teachers and a past president and a life member, Dr. Michael Ijiku, who happens to be the MD of the Foundation Hospital. The aim of this program is to create a health awareness and to instigate or inspire health promotion and healthy living. By way of a general introduction, health is defined as a sense of lack of, a sense of general health is defined as well. Now, what that means is that if you are not physically sick in your body, you're not happy at home with your salary, we don't consider you to be healthy. So health is beyond just physical comfort. The essence of this is to help the population, the society, to understand that our aim is to make sure that everybody has a sense of well-being in these trying times. You agree with me that economically a lot of people are struggling, and that has brought a strain on a lot of things that affect us. Now, generally, when we're talking about health, what we want to dwell on this morning are issues around primary prevention, issues around exercise, issues around the things that we need to do to ensure that we keep fit, the things that we need to do to ensure that we prevent certain illnesses, both those that are communicable and non-communicable, the things that we need to do to ensure that we have a good social relationship.
Dr. Gbayan, what's your weigh in on simple lifestyle changes that may improve a healthy well-being of people?
Okay, thank you so much. Yes, just as the first presenter rightly said, this morning our aim is to look at to enlighten the public on simple tips on how to live a healthy life. Just as he said, health is not just the absence of disease. It's everything about your well-being. So let's look at first your preventing the basic things, the basic health challenges that affect individuals. I would have loved to. I'm a gynecologist in training,
yes.
So I will be biased,
yes.
And I'm a lady, so I will be a bit biased. I'll talk more on
issues
ladies,
affecting women,
issues affecting women, children, then men, because I have a father, I have a husband, I have a boy. 2 to 13 years. You hear mothers always complaining, vaginal discharge, itching. This is a very common thing in that age group. And it's very disturbing for these mothers. But tiny tips could prevent. They are young, the anatomy of their private area is so peculiar, and then it makes them prone to certain infections. So you see a mother coming to you, doctor, my child is always having toilet infection. You agree with me that that's like the reigning thing, and most pharmaceuticals and herbal medicine people, they've used that to their advantage. Come and do this. But big words, but the wider is not together, it's not opposed together. So that prones them to having infection around that area. And then also, because of a hormone we call estrogen, do not have that resistant ability to infection. So these children tend to have recurrent infection. So for these children, mothers, please, you have a child of 2 to 13 years, those who you just finished potty training them, make sure you won't stop a child from playing on the floor, but let's take good care of them so they won't have to be playing inside the sand. So as sand, because that's part of where they get those infections. And then children, as they have upper respiratory tract infection, that is cough, they will touch their nose, touch their mouth, then their hand will still go back to their P area, transmitting infection from up to down. These are some of the places they get infection from. So when you have a child, let's do well to take care of that. And then also at night, as they go to bed, they should not remove their tight undies. Just wear them something light, cotton pajamas, and something very light. It will help in the aeration of that area, so as to prevent that toilet infection they have been telling you forever. Then it's a good thing. It's not a disease. It's a physiologic condition. It's something we all welcome. But sometimes it's associated with issues that can be challenging. These things are avoidable. Most are avoidable. How do we avoid them? We avoid them by, once you notice that you're pregnant, you miss your first period, your second one. Most women will take a pregnancy test after the second missed period. Once you notice you're pregnant, please book for antenatal visit. So your doctor will evaluate you, look at you and see if there is any issue that may cause you problem in this pregnancy. That will help you. According to World Health Organization, that will help take care of plenty issues that may arise while in the course of the pregnancy. Then there's this issue, folic acid. Most of our mothers, they start taking folic acid like maybe when they are 4 months pregnant. But the truth is, at that point, you won't really benefit much from folic acid. Folic acid is best used during the first 3 months of pregnancy. Babies make use of this folic acid so as to grow, because the first 3 months is when babies grow. When babies develop. That is when they need that folic acid. So once you know you're pregnant, in fact, according to the standard practice, when you're anticipating, you're preparing for pregnancy, you start taking folic acid 3 months before you take in.
All right. Okay, we'll dive deeper into other aspects as we go along. Dr. Apande, I am with you now. You are a family medicine practitioner. Help us understand why regular medical checkups are essential for maintaining good health, and how often should people visit their doctor or consult their doctor for medical checkups?
Okay, thank you for the question. Regular medical checkup is very essential. As we said, a healthy person or a healthy body is a foundation of a happy and productive life. So for us, and a healthy body requires a proactive approach for you to achieve and maintain a healthy body. So regular medical checkup is essential for everybody, from the younger ones to elderly people. So like we said, like they have said earlier, it's not just when you are sick that you should visit the hospital. You should visit the hospital regularly. So and it's different for every group of people, every age group of people. Now for children, there is what we call Where Child Clinic in our tertiary institutions, where as early as 6 months, a child is supposed to visit their pediatrician, and before the eruption of the primary teeth, the child is also supposed they become visible. And a person, everybody from children to adult, at least once a year, a person is supposed to visit and visit their physician and evaluate themselves. And because at every stage, for children, there are preventive measures that can be taken for health education, opportunities for health education to avoid some kind of health challenges that occur at certain ages in their life, for like vaccination, health education to prevent injuries for toddlers who usually play in their houses to avoid domestic accidents. And then for adults, when you are growing up, there are also times you need to visit your doctor, because like for ladies, once you're about 9 years, you should take your HPV vaccine, and then from there, at around 21 years, you start your cervical cancer screening. So both for physical evaluation and screening for medical condition as a way of primary prevention of disease, we adults, like for men, we need to also visit at the age of 40 years to exam. That's what we call a prostate exam, to check for your prostate and do some other investigations, so that you will have a baseline and your physician too will keep your record for future, because you get tips from your doctor to achieve a healthy living and maintain it.
All right. Now, doctor may visit their physician to consult or screen for. So speak more to us on what are some of the common screenings adults should undergo in terms of medical checkup.
Okay, thank you, Mr. Nat. Well, just to give a general overview, and then I will delve straight into your question. Just to say something on what you've said. Some of the things that we dwell on in the health visits or the regular screening visits are things that border around your nutrition, things that border around the physical activity. We try to encourage or discourage people from practicing a sedentary lifestyle. Things that border around the sleep, we encourage people to sleep. And for adults, we encourage to sleep at least 7 to 9 hours. We also speak to people around issues that have to do with managing of stress and then their mental health. Now, with regards to and of course, substance abuse and substance use. Now, with regards to the preventive care that you talked about screening, the common things that we screen here include things like hepatitis B and C, HIV screening, cervical cancer and breast cancer screening for women, and he mentioned the prostate screen and prostate examination. We also screen for other non-communicable diseases like cardiovascular illnesses like hypertension. We screen for things like diabetes, mellitus. And what do? You will check your blood pressure to ensure that it is within the normal range. And if you see that it is not within the normal range, we take appropriate actions to deal with that. We also do screening for diabetes by doing a fasting blood sugar, your fasting blood glucose, to ensure or to see that it's within the normal. If it is not, we also try to institute appropriate care. Now, of course, we do some other physical examinations to ensure that there are no disabilities that can restrict your regular or normal work. Of course, other things that we can do include things like your cholesterol. We can check that as well. And then we can also calculate your body mass index using all those figures, your height, your weight. That helps us to know if your weight is within normal or not. Then we can also even look at also other mental issues. We can screen for mental issues. We want to look at your mood. Are you happy? Are you sad? Are you a lot of respiratory problems? People coming down with a lot of respiratory illnesses. So we can screen for some of those things. And of course, we try to check for children that are growing. We try to check their joint system, their walk. And then, of course, we can even do some screen the digestive system as well. So these are some of the things that we can, we screen efficiently or effectively when you visit the hospital.
All right. You talked about screening for one's blood pressure. For an adult, for instance, a blood pressure should be between what range for it to be normal? And of course, blood sugar as well to prevent diabetes.
Okay, so for the hypertension, your blood pressure should be between should be less than 120 for the systolic, that is the upper limit, and then 100 to 120 for the systolic. So once we start going above that, we need to now do further evaluation. That is the best range, but generally what we have now is less than 140. But once it is more than 120, we may need to start evaluating. So that is the range that we target. Now for the random blood sugar, it should be less than 11 millimoles per liter. For the fasting blood sugar, it should be less than 7 millimoles per liter. So if it goes above that, we now need to say, let's modify your lifestyle, let's modify your diet, and then we'll see. We'll observe. If it doesn't give us the result that we want, we may now decide to go to pharmacological therapy or other means of controlling your sugar level. And that applies as well to your blood pressure.
All right. You also touched partly on cardiovascular issues.
Yeah.
At a time where Nigerians are grappling with a lot of hardship, how can they avoid predisposing factors to such cardiovascular issues?
Okay, that is a very critical question. Thank you very much. Now, you see, there is what we call the modifiable and the non-modifiable risk factors. Now, of course, with the current situation of things in the country, the modifiable risk factors are taking a center stage because they're becoming one of the main predisposing factors coming down cardiovascular issues. Now, what are some of these risk factors? For the modifiable risk factors, you have things like a family history of cardiovascular issues. We have things like age. We have things like sex. We have things like race. So for an individual whose father or mother or a sibling has hypertension, that individual has a higher chance of coming down with hypertension or cardiovascular issues, as the case may be. And it's common for our environment. We've noticed that it is commoner among blacks. So those of us in Nigeria who are Nigerians, or even from Benue State, we stand a higher chance of coming down with this. Then, of course, it is also commoner amongst older people. So when you see, but we're beginning to notice a trend that we're seeing it in younger people as well. But we can also attribute that to lifestyle changes, like we are seeing more younger people that are obese and a lot of... Anybody who has a family history, for instance, of a cardiovascular event, it is encouraged that you start your hospital visits and regular checkup early. So now we have things like alcohol intake, excessive alcohol intake. We have things like a sedentary lifestyle. So people who live a sedentary lifestyle, you are always sitting in one place. You know what? We're in an age of remote work and all that. So a lot of people sit down.
Work smart.
Yeah, people sit down in one place and work for hours. So we encourage that you should be active. If you must stay home, then you can get a treadmill or something, gym equipment that you do some exercise. You don't encourage people to stay in one place for long. That is a predisposing factor to cardiovascular events. Now, also another modifiable risk factor is smoking, very critical. So we encourage complete cessation of smoking. So if you are a smoker, we encourage that you smoke, because smoking is a risk factor for a lot of issues, cardiovascular, non-cardiovascular. Almost every cancer is implicated in smoking, including breast and cervical cancer. So we encourage cessation of smoking completely. That is one of the risk factors for that as well. Now, stress is also a risk factor for cardiovascular disease. And of course, I know that in the course of this program, we may discuss stress management and all that. But people who are excessively stressed, either from work, either from family schisms, or from any form of stress, they stand a higher risk of coming down with cardiovascular disease. So we encourage people to manage stress properly. That helps as well. So these are some of the modifiable risk factors that can predispose one to cardiovascular disease.
All right, Dr. Gbayan, speak to us more about prevention of cervical cancer through maybe the vaccination for human papilloma virus.
Okay, thank you. As we all know, cervical cancer is one of the second most common cancer in women, and especially in sub-region. So there has been ongoing awareness program campaigns on cervical cancer. Cervical cancer is a good cancer. I use that word for it. It's a good cancer because it avails you the opportunity that I'm here. Oh, come on, you can look out for me. Then it gives you the opportunity to take care of it before it causes problem. The preventive measures are just as you said, through vaccination. And luckily, we thank God that has been incorporated into our immunization schedule for children from 9 years to about 15 years. You take the vaccine. Currently in Nigeria, we are issue. Then after 4 weeks, you take another. Then you take the third one. And it covers you for a long period. Then for adults, currently adults who have been screened for the virus, that is hepatitis, human papilloma virus, if you've been screened and you're negative, you can also get the vaccine, though you need to pay for it. It's not as free as for children. For children, 9 to 15 is free. You can always take your girl child to go and get the vaccine. But for adults, no, you have to pay for it after being screened. That is after being screened for human papilloma virus DNA. Then we also have a screening modality which is called pap smear, which include taking just a few cells from the mouth of your womb. We call that the cervix. You take a few cells from there, subject them under some chemical, and then you watch under the microscope to check for some changes. We start that for a girl who is sexually active. You start that at 21 years. Then you do it routinely for 3 years, up until you're 65. If there's nothing after 65, we stop. Then there has been advancement in cervical cancer screening, which include the DNA, human papillomavirus DNA I talked of. You check that. That is, you also have to pay for that too. You do that for 5 years. If you check and you're negative, you continue checking it for 5 years. That is it about cervical cancer prevention and screening.
All right, but the symptoms or risk factors and possibly the signs, because you mentioned that it's a good cancer, in quote, that it shows you I'm here. What are the kind of symptoms that women should watch out for?
Look out for their risk factors, not symptoms.
Okay.
Because you don't want to wait for it to start.
Yes.
So there are certain risk factors. For example, being black is a risk factor. Then the age at which you started.
Why are the black people always at risk of almost everything? It's our black skin, because not at all. I don't think so. Don't mind me.
Not really. It's just our way of life that has predisposed us to certain things that make us high risk, sort of.
Okay.
Not just because of our black skin. Okay, so then the age at which a girl started seeing her menses. Some girls start seeing their menses at 9. Some start at 12, 15, 16. That is a risk factor. Early penetrative sexual intercourse is also a risk factor. Having multiple sex, because human papilloma virus, which is the cause of cervical cancer, is a sexually transmitted infection. That is what we should know.
Okay.
So, having multiple sexual partner is a risk factor. Engaging in high-risk sexual practices, smoking, alcohol, multiple pregnancy, like a woman who has had like 10 children, 15 children. These are risk factors for cervical cancer. Now, when a woman has developed cervical cancer, what are the symptoms? What do you see that tells you there is already an issue? This woman would start complaining of pain during sexual intercourse. She tells you, whenever I meet my husband, I feel pains or I see blood. Though these symptoms are not peculiar to cervical cancer, but they are danger signs. When you see them, do not keep quiet. Make sure you visit your gynecologist. For you have pains while meeting with your spouse, you see blood after meeting with him, is a danger sign, especially in a woman who is 35 years and above. Other symptoms that you could see, you could have vaginal discharge, which is it has a unique smell. We call that amniotic smell. Though that's before you get to that, that is like an advanced stage of the disease. When you start having that, is a pointer to something. Then you can be bleeding in between your menses. You see your menses today, after 2 weeks, you see again. It may not come as classic as your normal menses. These are symptoms that are telling you that something is not well. Again, as I said, these symptoms are not peculiar to cervical cancer. Other symptoms are other conditions related to women's health can also be, that's bleeding in between your menses, then you have a cervical cancer. No, but it's a pointer, so you should seek for help.
All right, Dr. Apande, speak to us on prostate cancer. What are the signs to look out for, and how can it be prevented in the health of men? And are there categories of men who are prone to it in terms of age?
Thank you for the question. Of course, there is it's an age limit or age group that once you reach, you start having, or you are prone to develop prostate cancer. But generally, what is more prevalent, what is more prevalent in our society is the benign prostatic hyperplasia. We call it when the prostate begin to just swell up, grow in size. Because as we know, the symptoms, the prostate has the urethra pass through the prostate for where we urinate for men, and it's an organ that is only in men. So when you reach 40, many people will start experiencing signs of force. They need to force themselves before they urinate. The urine doesn't stop immediately. It starts dribbling after they finish and they're about to dress up. And then there is also a feeling, because there is always always needed to apply pressure for them to urinate. When they just stop applying the pressure, the urine stops and they could feel that they have finished. But the urine will still remain in the bladder, and immediately they go back to work, they will start feeling a need to urinate again. So they will go back to urinate, and this cycle will continue. At some point, they will start to develop urinary tract infection because of the residual urine that is always remaining in their bladder, and they will begin to increase their frequency of urination due to the effect of not completely emptying the bladder and urinary tract infection. And when it continues, at some point they will start to urinate with some blood inside. So those are the commonest symptoms of prostate cancer, prostate that we see in men. And so when they come to the hospital for screening, the doctor performs a prostate exam, there are physical and imaging exams that are done. The physical exam, many people know that the doctor put their hand in their backside to check for the size and the surface of this prostate. The information we get from the surface will tell us whether the prostate is cancerous, that is growing to become a cancer, or is just growing big but is benign, it's not cancerous. If it is smooth and the prostate has a peculiar shape with a groove behind it, and when we touch that groove, we know that this shape is still maintained even though the prostate is swollen. And if the surface is also smooth, we know that it is not a bad sign, because cancer is an angry situation. It has no respect for anatomy, as one of my teachers would say. It will just disrupt what is supposed to be and bring in its own way of growth. So when a man starts noticing that he's urinating frequently, especially at night, and then he's having feeling of incomplete voiding, when he goes back and he doesn't feel completely empty, and when he's having to strain to urinate. And this straining, it comes, there are other things that could make someone to strain. There is, when you have urinary tract infections in the past that have caused stricture in the urethra, that could also cause or lead you to strain before urinating. How we differentiate from when we are talking to the patient is, when you strain, does the urine come out or does it worsen? Then we are able to differentiate between them. But once you come to the hospital, and the doctor will evaluate you. After the physical exam, we now go to do imaging. You can do a pelvic scan, which will measure the size. It will not tell us the size. The scan will also tell us the structure, the structure of the prostate inside. If there are calcifications, there are some changes in the anatomy, as we know. Then we begin to go further. We take sample from the prostate. We call it prostate biopsy, to go and do histology. So those are the symptoms of prostate, because the cancer and the benign prostatic hyperplasia, they sit.
All right, dear listener, if you are just tuning in, you are listening to Perspectives on Agate Radio, 95.5 Star FM, Makurdi, and our discussion is focused on sensitization, on healthy living. This edition is sponsored by the Association of Resident Doctors at the Federal Medical Center, Makurdi.
With our live streams on YouTube at Agate TV and Facebook at Agate Radio TV 1. For behind-the-scenes highlights, sneak peeks, and exciting updates, follow us on Instagram at Agate TV. Don't forget to take your experience to the next level. On TikTok, we are at Agate_TV. Agate Media, the people's voice.
Welcome back from that short break, and you can also participate on the program by reaching us on 0814-335-9292, 0814-335-9292, and the line which is available for SMS and WhatsApp is 0912-699-9404, 0912-699-9404. Now, Dr. Dogoh, let's dive deeper into routine immunization, especially for children. You are a family physician. What are the risks associated with not vaccinating children, and what ailments, conditions can be mitigated through proper vaccination for children?
Thank you very much. I was waiting for when you will ask me that question because
and luckily the question is here now.
because immunization is one of the most critical areas that we lay a lot of emphasis on. And in a program where we are talking about health awareness, health prevention, disease prevention and health promotion, there is no way we can skip the critical issue of immunization. Now, the reason why immunization is very critical is because there are a lot of illnesses that have the potential to kill a child within 48 hours that can be completely and absolutely prevented by immunization. There are a lot of illnesses that have a potential to disable a child and to render that child's future ineffective that can be completely eliminated by immunization. So what that means is that if immunization is not taken seriously, a child's future can completely be affected. So it is very critical. Now in Nigeria, there's what we call the MPI schedule, that is followed in immunization. But I'm going to highlight a bit of some of the illnesses that we prevent through immunization, and then try to talk about the times that this immunization is supposed to come on. Generally, the schedule covers a period from about 0, that is day 0, that's the first day the child is born, to about 12 months or up to 9 years, because the HPV vaccine is given at 9 years to girls that are 9 years, right? These that are given, are prevented through the immunization schedule include the BCG is actually meant to prevent tuberculosis. The other is what we call the OPV, which is the oral polio vaccine. Now, the oral polio vaccine prevents against polio. So we give the first dose, which is OPV 0, which is given at birth. And then we have, at birth, we give OPV 0 and also give the BCG. And then we also give the hepatitis B vaccine. Those are the vaccines that we give at birth. Now we have the OPV 1, OPV 2, OPV 3 that are given at 6, 10, and 14 weeks respectively. Then we have the inactivated polio vaccine, which is also given at 6 and 14 weeks. Then we have the pentavalent vaccine. Now the pentavalent vaccine contains 5 vaccines against 5 illnesses. So the illnesses that are captured in the pentavalent vaccine include diphtheria, pertussis, tetanus, the vaccines. Now these vaccines, like I said, these illnesses are illnesses that, recently there was an outbreak of diphtheria, I think sometime early this year.
Yes.
And these are illnesses that have the capacity to completely kill a child or to disfigure the child. So these are captured in the pentavalent vaccine. Then we have critically the measles vaccine. The measles vaccine is given between around 9 months. Then we have the vitamin A that we also give. We have we have malaria vaccine. The malaria vaccine as well. The malaria vaccine as well has been introduced in our schedule for the country. So now we give malaria vaccines as well. Then the human papilloma virus vaccine. The human papilloma virus vaccine is very critical because it helps to prevent cervical cancer. And we're beginning to see cases of cervical cancer in younger women because of, our change in lifestyle. We're having issues of early coitus, that is early initiation of sexual intercourse. We're having people that are having a lot of sexual partners. So that is beginning to increase the number. Now this is going to be, so to say, hopefully a game changer that will help parents and caregivers to ensure that once a child is born, just to state that these vaccines are actually free. Most of these vaccines are actually free. So all you need to do is go to the hospital and just get the vaccine and go, and then follow your schedule regularly. That can be the only thing that will be the difference between the future of that child. Thank you.
All right, Dr. Gbayan. I would like you to chip in a word briefly on this issue of routine vaccination for children and the HPV vaccine, for instance. There are some myths associated with it that it renders women to a state of infertility. To what extent is that true?
Okay, thank you for that question. It's a false scientific basis to that argument, and I wouldn't want to use some harsh words on people who are bringing that up, but I want you to know that human beings generally are resistant to change. People suddenly welcome, they want to say so many things about it before they finally agree. You agree with me that due to some political issues or cultural issues have brought up issues like this, but I want to emphasize people in the Western world, they've been using this particular vaccine for decades before it was finally brought in here. There has not been documented because we are scientists. Yes. We work based on evidence. Yes. You may say side effects like maybe pain at the injection site. The patient maybe the first time taking the vaccine felt some malaria-like symptoms. These are normal things. They shouldn't cause an issue, but it does not reduce the fertility of a woman by any standard. It is not scientifically proven.
Very well.
So I will want to encourage mothers, I want to encourage fathers, caregivers, please take your children for this vaccine. If you have seen where a patient is dying from cervical cancer, you will never wish even your worst enemy to have cervical cancer, not to talk of your child, not to talk of yourself. So, to answer your question, HPV vaccine is safe and is recommended and has been used for decades and has no proven evidence that it affects fertility.
All right, so no side effect at all. The public should take note. We'll take a short break.
You can also receive us through our website, www.igetradiotv.com, Radio Garden, and social media platforms. You can dial 0814-335-9292 or send a text message or WhatsApp message to 0912-699-9404 to participate on the program. Remember, Perspectives is where your opinion counts.
All right, welcome back from that short break, dear listener. At 10 o'clock, a few minutes away, we'll start engaging with you. Dr. Apande, before we start engaging with the listener, I would like you to speak to us briefly on how cases of diabetes can be curtailed through lifestyle modifications.
Okay, thank you very much. Diabetes mellitus is a metabolic condition that affects the metabolism of both carbohydrate, protein, and fats. So it has characteristics of high blood sugar and the accompanying symptoms. So in the population, there are people who are normal people who have no symptom or who are not close to having diabetes. There are people who are close to having diabetes, and there are people who have diabetes. We call the close to having diabetes as pre-diabetes, and these are separated based on your blood sugar. So just like every other chronic condition, diabetes has both modifiable and non-modifiable risk factors. So the modifiable risk factors are the ones that we will talk about, because this is a health promotion session.
Yes.
So the modifiable risk factors are your lifestyle that you embark on. That, because remember we say that attaining and maintaining health is a proactive approach. You have to resolve to, one, eat a balanced diet, eat healthy, more of don't overeat carbohydrates and neglect protein and fat. Eat a well-balanced diet and exercise regularly to maintain your blood sugar. And then weight management. These are the two critical factors in development of diabetes as concerns modifiable risk factors. So in terms of nutrition, it's advisable to always eat fruits, vegetables, meat, and whole wheat and protein in the right proportions and the right amount. A normal diet should contain of half of your plate should be green, while the other half you divide it into half again, and the one of the quarter should be protein, that is brown, and then the other should be carbohydrate. That is how we should strive to eat on a daily basis. In this our economic situation, it's very difficult to tell people to eat like that, because when you go to the market, the prices of food items is skyrocketing on daily basis. But for the purpose of a healthy lifestyle, because health is wealth, if you have any amount and if you have money and you become a diseased person, you're always visiting the hospital, buying medication. And medications for diabetes for 1 month now is nothing less than 5,000 per month. That is for those unbranded medications. So it's better to now maintain a healthy lifestyle through healthy eating. Now, in terms of weight management, we've already mentioned a concept of body mass index. So when you have a body mass index exceeding 25 kilograms per square meter, that is when you are tilting towards developing either pre-diabetes and consequently diabetes itself. So a person should strive to maintain a body weight between 18.5 to 24.9. Now, how do we maintain body weight? One of the things we should do, apart from eating healthy, is to do or engage in regular, moderate exercises. Move more. When you move more, you improve both your cardiovascular system and your body shape, and you lose fat. And losing fat is one of the critical points, because fat is one of the things that increase your body weight and then cause insulin resistance that result to diabetes. And then to also avoid other things like smoking, excessive alcohol intake, So these very two critical issues of weight management and nutrition are at the core of preventing diabetes.
All right. Dear listener, we'll start taking your course, but that will be after this short breather. Kindly stay with us.
Don't the water grow the tree?
All right. Sorry for that mix-up.
You have family members.
All right. you are still listening to Perspectives, and our discussion is focused on sensitization on healthy living. This edition is sponsored by the Association of Resident Doctors at the Federal Medical Center, and you too can participate on the program by calling in on the numbers 0814-335-9292, 0814-335-9292. The SMS line is 0912-699-9404. Please stay with us as we take a short break, and after this, we'll start engaging with you.
RadioTV.com, Radio Garden, and social media platforms. You can dial 0814. You can also receive us through our website www.igetradiotv.com, Radio Garden, and social media platforms. You can dial 089-9404 to participate on the program. Remember, Perspectives is where your opinion counts.
Welcome back from that short break, dear listener, and we'll start engaging with you now. If you call, please, we'd like to know your full name and where you are calling from. Then you make your submission. Kindly keep it very brief once you engage with us. Good morning. Hello. Okay, you are on, but we can barely hear you. You may try to connect with us back. The line is still available. Good morning.
Hello, sir.
Good morning. Welcome to Perspectives.
Thank you. Good morning, sir.
Thank you.
This is Mr. Bartholomew from Oju.
Okay, Bartholomew who?
Bartholomew Ode.
Bartholomew Ode. Which part of Oju are you reaching us from?
I'm calling from Ogangan area.
Good. Go ahead, Bartholomew.
Yes, sir. I have a question to ask on the side of hepatitis B.
Yes, go ahead.
My question is this. If one is with hepatitis B, what could be the symptom? And then secondly, does it lead to infertility as a man? Then the other question I would want to confirm is it really curable? If it is, I will want to have either a personal number from the doctor that
respond to that.
Great.
Thank you very much. Okay, Bartholomew wants to know more about hepatitis B. Of course, as we go along in the discussion, we will talk on that as to help Bartholomew on.
Nathaniel,
thank you for
the guest in house.
Thank you.
Thank you. Thank you for your great work now. I'm calling you behind NSCC medical station along Makurdi Ali Road.
Very well. Corner, go ahead.
A woman who is expecting pregnancy of a pregnancy. Can I know where is it advisable to find the vaccine, to get the vaccine, or to get the folic acid? Sorry.
Okay, Corner. Your voice sounds like a man anyway, but you want to get it for your woman, or that's okay. Thank you. We have noted your question.
I'm a married man.
Okay, good. Could that be all from you, Corner?
No, I also want to ask. There are children who have been given for under my care. One of them is 7 years. The other one is 9 years. Their mother didn't take them to that regular vaccine schedule that they give. So I want to know, is it possible for me to take them now to the hospital and give them those vaccines?
Okay. Thank you. To know about folic acid. And of course, the issue of vaccination too is mentioned about it. Good morning. Welcome to Perspectives.
Good morning, Nat.
Thank you for joining us.
Well, thank the guests in the studio. This is a very wonderful topic because your sound heard is your word. So I may like to start from the masses. The issue of non-compliance is affecting the masses because the experts take a time to go out and look for a drug, and the government support the experts to provide the drugs to come out and immunize our people, both children and adults from our localities. But when the participants go there, we are involved in those immunization exercises in our local community. So when the participants go there, we experience human activities, and we need to be presenting them to be vaccinated to avoid contact diseases. I think government is doing a lot. Comparing the word virus, I think if you don't deeply understand the meaning of virus, but you will think that there's something that is very, very affectable for the human living. Let's compare what happens to HIV/AIDS. It was a virus, and Ebola was a virus. Then Corona was a virus. Up till now, I think the government go ahead and provided the human papilloma medicine for the children of 9 to 15 years thereabout. But to present our children to be vaccinated, it has become a problem. So the issue of non-compliance is one of the issues that is affecting the masses. So I believe government will double its effort by make sure that the monitoring team will follow after any round of immunization. Thank you for the opportunity.
Mark, thank you for calling in. We appreciate you. The people should comply with immunization schedule. It is for the well-being of citizens. That is what Mark is telling you, the listener, and all of us. Good morning. Welcome to Perspectives.
Hello.
Good morning.
Morning.
Thank you for joining us on the program.
This is Moses from Deer Village.
Okay, Moses who?
Moses Falzwanaga.
Very well. Go ahead, sir.
I'm suffering from that prostate cancer. And I don't know whether you can treat it in the hospital. Hello?
Yes, we are with you, Moses.
And I don't know whether I will get treatment from the doctors who are talking on the radio.
Okay, have you...
Please in the hospital, St. Teresa.
Okay. Have you been given medications?
I'm taking drugs, but in fact, there's no improvement.
Okay, maybe the doctors will speak more on that. We'll request them, since you are already...
Thank you very much.
Thanks for calling. All right. We are going to also highlight so that he will understand maybe what more he needs to do. Maybe sometimes when people start taking medications, they want an instant relief. Good morning.
Hello. Good morning, yes. Good morning to your guests in the studio there.
Thank you.
Yes, I am Engineer Sunday Akpankole from Makurdi.
Good to have you.
Yes. Thank you very much for bringing this group of professionals to enlighten us. I commend the resident doctors for doing that. If they can be doing that often, to be good, because they are enlightening us. It is said that ignorance itself is a disease. So having enlightened us today, I think they have eradicated one disease from our bodies. Having said that, I want to ask the question, they gave us tips for healthy living, exercise, good nutrition, and the rest. What of forgiveness? Because I believe that when you keep balance and you don't forgive people, you go to bed, you keep balance, could that also attribute to ill health? I wanted to speak to this for us. Thank you very much.
Okay, Sunday, but thank you very much. Anyway, the doctors are not religious leaders. They are speaking as like scientists, but that's okay. It's for them to respond and not for me. Thank you all the same for calling in. Good morning.
Good morning. Good morning, sir.
Thank you for joining us on Perspectives.
Yes, my name is Theophilus again from Ikbango.
Welcome, Theophilus.
Yes, thank all the guests. For any disease, routine immunization is the key for protecting and preventing any disease coming into our body. But the fact is that some people are ignorant for the fact that they need to protect this disease before they come into our body. So the key, the paramount issue there is to give information, to disseminate information into the nook and corners of this country so that people will be aware for the fact that if they prevent earlier, they will not be prone to this disease. If you allow the disease to enter your body, it's not time that will begin to suffer for it. So what I say is that I want to totally agree with other callers so that our people should be going in and out every day to go and immunize for themselves so that they will not be contacted from this disease. If that is done, everything will be okay. By fighting it, I believe that is a paramount issue. So I want to agree totally that prevention is better than. So those who are the helm of affairs should disseminate information for every community so that we'll be going out every time to be immunized so that this disease will not affect them. Thank you.
Thank you, Theophilus Abe, for calling in. And that is why we're here at Good morning and welcome to Perspectives.
Good morning. My name is Andrew.
Okay. Andrew who?
Okereke.
Yes, Andrew Okereke, where are you calling in from?
I'm calling from Gadovina, here in Makurdi.
Okay, we are listening to you, but could you kindly move away from your radio set or turn down its volume, Andrew?
Okay, I'll move away.
Thank you. Go on and speak to us.
I want to ask a question. My question is it possible for someone to have hepatitis B and still not functional in the body system?
I didn't get you quite clearly. Could you say it again, Andrew?
Is it possible for someone to have hepatitis B and still not functional, as in, is still not functioning in the body system?
Okay. Could that be all from you, Andrew?
Yes, sir. Thank you.
All right. Thanks for calling in. Anyway, doctors understand all kinds of questions and all kinds of writing. That is why they write anyhow. Don't mind me. The doctors, only them understand that language and writing. So, good morning. We hope you get to.
Good morning. Yeah, good morning, sir, Mr. Nathaniel.
Thank you for joining us on Perspectives.
Yes, my regards to your guest in the studio, sir.
Thank you.
This is Vincent Ako. I'm calling from Ishabakut Road.
All right, Vincent, we're listening to you.
Okay, I want to ask the medical professionals in the studio that those children that are already having kwashiorkor as a result of malnutrition, how can we return them back to normal? Because I heard them talking about good diet too.
Okay, could that be all from you, Vincent?
Yes, sir, that's all. Thank you very much, sir.
Thanks for calling in. To tell us more on that. Good morning. Hello, good morning. Okay, you are on, but your voice is not coming through. Let's take a moment briefly and come back to the studio before we engage with the listener again. I will start with you, Dr. Dogoh. You listen to Bartholomew Ode, who called in from Oju. He wants to know about hepatitis B, whether it's curable and whether it leads to infertility. Similarly, related to the issue of hepatitis is raised by Andrew Okereke from Gado Villa, who also wants to know whether it is curable or whether it's functional in the body. That was the language I didn't quite understand it, but you doctors understand everything. So speak to us, Dr. Dogoh.
Okay, thank you very much. And I want to appreciate our listeners for the questions. It means that they were keenly listening. Now, let me address the question on hepatitis. The first thing is that, well, I'm not aware of any literature except my colleagues are aware of where it's stated that hepatitis causes infertility. What I know is that it is an effective communicable disease like sexually transmitted infection like any other, and it does not necessarily cause infertility. If someone has a disease and has infertility, we may need to elaborately investigate for possibly other causes as well. So I don't think that is a major concern as far as hepatitis is concerned. Now, he also asked if it was curable. Yes, hepatitis is curable to an extent, and let me explain what I mean by that.
The B variant in particular?
Yes.
Okay.
Now, there are certain people that come down with, get infected with hepatitis, and the body clears it. The body's immune system clears it out. So somebody might have been infected, but the body clears the virus, and you can actually even do a test and you don't find. However, there are some that happens within the first 6 months. However, there are some that come down with this infection, and after 6 months, we now call it a chronic hepatitis B infection. So that may not be curable. What happens is that people can have this virus. In fact, the majority of people that have this infection go on to live their normal lives. The virus is in the system, but it does not cause any problems whatsoever. It's just there. Others may come down with some complications that we manage appropriately. Then someone else asked if it is possible to have hepatitis B virus and see functional and not have the symptoms. So basically, that's what I was trying to explain earlier, that you can actually have hepatitis. In fact, the truth is, majority of people who have hepatitis B virus don't come down with symptoms.
First, what kind of symptoms, if at all, they may manifest?
Well, the symptom of what we call a right hypochondrial pain, because hepatitis usually affects the liver. So you may start having discomfort around the region where the liver is located within the abdominal cavity. You can have that. You can also have yellowish discoloration of your eyes, what we call jaundice. So your eyes may begin to turn yellow. These individuals also may begin to have some form of abdominal distension. They may begin to have difficulty with their digestive tract. They may even have vomiting. They may vomit blood, depending on the extent to which the disease has progressed. So they are different. The symptomatology depends on the extent of the disease. They may just have malaise, just a feeling of being sick. Some may even come down with some form of fever, and others. It depends on the extent to which the disease has progressed. But generally, people who have it and don't have symptoms, they may just live their normal lives without any problem or complications at all. So that is that about. But just to chip in that hepatitis B is actually preventable, and that is what our adults will encourage you to go and know your hepatitis status, particularly hepatitis B, which has a vaccine. So if you do a hepatitis B surface antigen and it is negative, go on and get the vaccine. The vaccines are not in that so expensive.
No,
it's very cheap. They are free. So you can go ahead and get the vaccines. In Makurdi here, you can go to the epidemiology unit opposite BSU second gate. They offer the vaccines there. You can go to Federal Medical Center. They offer the vaccines there. You can go to even the teaching hospital and get the vaccines. And I'm sure some of the primary care centers and general also offer the vaccines. So these are things that we should be eager to do. Everyone is encouraged to go and do a testing. And if you are negative, please go and get a vaccine. Go and get vaccinated. If you are positive.
Bartholomew and, of course, Andrew, you have gotten some information. Dr. Gbayan, speak to us on what can be done to curtail kwashiorkor, maybe through malnutrition, chicken malnutrition. Vincent Akko wants to know that.
Okay, thank you. Let me chip in a word concerning the first.
Fine, go ahead.
Okay, so for our first listener who asked that question, hepatitis B, just as the first speaker said, does not cause infertility. However, hepatitis B affects the liver, and if it does, the liver is a major organ that produces some hormones that sort of regulate how sex hormones work, both for male and for female. So if your liver is affected as a result of hepatitis B, you may develop infertility, but not as if hepatitis B causes infertility. I hope he gets the point.
All right.
So he should go to the hospital. Maybe he's having some form of liver issues that are causing him infertility from hepatitis B, but not hepatitis B. So for kwashiorkor, yes, looking at the insurgence of insecurity, children being displaced in IDP camps, with poor feeding because of improper feeding, that is gradually coming back. Okay, for a child with kwashiorkor, we do nutritional rehabilitation for them. Usually, what they do is you take them, there's a special diet because the body has so been malnourished to a point that you don't just bring them and start feeding them with the normal food. There's a process they undergo such that these children will be introduced to certain meals at a very calculated interval, with the meals, the calorie intake, the vitamin, nutritional value of the food is calculated strictly so as not to cause harm to the children, because children who have developed kwashiorkor, coming to restart them with proper feeding could be a poison to them. That will be what might even kill them other than the kwashiorkor. So to answer your question, these children will need a nutrition rehabilitation.
All right. So, Vincent, I believe you've been answered too. Dr. Apande, Moses Azwanaga said he's suffering from prostate cancer and he's seeking medical attention. You listen to him.
Yes.
Just help him understand how to approach the situation more medically.
It's okay. Like I said earlier, this has to follow a procedure to a certain level, and a diagnosis is made of prostate cancer. Now, I don't know how he followed it and whether there is a definitive diagnosis of prostate cancer that has been made. But if he's already at that level, the people that manage will refer to them. And everywhere we encourage people to visit the urology departments of hospitals. Now, it is managed in both using pharmacological methods, which is drugs, and to some extent or sometimes surgery is needed to prevent either the continual growth or the expansion of the cancer. And prostate cancer is also a very slow-growing cancer too. And because of the availability of screening methods, it's also a cancer that you can prevent its occurrence, or you can treat it early and prevent the dissemination, what we call metastasis, going to other organs. So if he has prostate cancer, I would advise for him, I don't know the doctor that he's currently seeing.
Yeah, he mentioned a head facility.
Yes, he mentioned a head facility.
If they have a urologist.
Yes, they may have a visiting urologist. That's what I don't know. So,
okay.
But what I'm emphasizing is the doctor who is seeing him should be a urologist, or he should be talking or collaborating with a urologist to manage him. That would be more appropriate, because I cannot prescribe surgery for him or even the drugs, because it's not a one-time event.
Yes.
Technology has helped us now to be able to help people via telephone, but not everything can be done via telephone. The most important thing is to know the information, where to go.
All right.
And see. And also the issue of kwashiorkor,
right.
that as she rightly said, the rehabilitation is a nutritional rehabilitation, but it's also important to know that kwashiorkor is a deficiency disease of nutrients in the body. Now, when these children have this disease, they have accompanying infections because their body is no longer able to mount a defense. So there are also infections that come along with this. There is a weakened immunity that comes along with this disease. So it's important also to go to the hospital, because the rehabilitation process is a carefully designed process that is done in the hospital. If it is not done properly, the heart is also diminish and the muscle of the heart become weak. So if you overfeed these children, they will now develop a heart failure because of the sudden influx of either fluid that you are giving through this feeding. So it is a carefully designed feeding, feeding that is done by trained health personnel.
All right, that's fine. So, of course, Moses Azwanaga, I believe you listen to the doctors, so they'll find out if the doctor you are consulting is a urologist or you need to check a facility again, depending on their perspectives.
Yes, Peter Tiller, I'm coming from IDB Square.
All right.
So I want to sincerely appreciate your guest. I want to for a wonderful doctor and then to end it with this contribution. Sir, doctor, there are people who always tell people to always go look for this traditional medication that is curable, that can cure hepatitis. They should not mind the doctors or hospitals. They are only looking for more. They can go with herbs and help to cure it. Is it true? And then another question is that where can people have access to facilities where they can get tested to know their viral load? Because there are some of my people, my friends, who are suffering from this. But when you ask them, I'm on the opinion that the government should help to provide a particular machine or even testing machine that can aid people who don't have anything, who but can get infected with this hepatitis, to go and test to know their viral load, so that and it's fine. And the drugs are very expensive, so government should also help.
Thank you.
And I want the doctor to clarify me on that question of health.
Thank you. Thank you, Peter. Your questions is noted. We'll respond to them. Thank you for calling in. Before we engage with more people, okay, just let's get to the line again. Hello, good morning.
Yes, it's Moses Azwanaga again.
Okay, Moses, thank you for calling back.
In fact, I was, they did scanning for me, and the doctor told me there are some stones in my bladder that are blocking the urinary. So I was asking if in their hospital I can come and see a urologist, or how do you call it? I don't know. Because the doctor I'm seeing is not a urologist.
Okay, Moses. Thank you.
Yes.
So we'll get the doctor. Doctor is just itching to respond to you right away. So stay on.
It's okay.
Thank you. Thank you very much. Yeah. Okay, so Dr. Apande, just you listen to him. So go ahead. You are itching to respond to him.
Yes, because if he's not seeing a urologist, the issue of stones in the bladder too belongs to the urologist domain. So he should come to Federal Medical Center as soon as possible and register to see a doctor, and he will be pointed to the right doctor to see him.
Okay, so Moses Azwanaga, please, you need to act on the advice of the doctor here, or maybe, I don't know if patients can ask the doctors are consulting a hospital to give them a referral, or he may just walk in as a patient and
without a referral too, we can still attend to him.
Okay, that's fine. Good morning.
Good morning, Chief Nathaniel Nongu.
Thank you for joining us.
I salute you and I salute your guests.
Yes, my guests and I have joined here in saluting you too.
Yes. My name is Osmond Nongu.
Osmond Nongu, where are you?
I'm calling along the Makurdi Market Road.
Very well. Go ahead, Osmond.
Please, I want to find out if the thing causes post-rate. If you have a partner and the partner is far from you for a long time, can that cause a post-rate? I want to find out that, sir. Thank you so much.
Okay, Osmond, thank you. I hope your partner is not far away from you. That's okay. Thank you, Osmond, for calling in. Dr. Gbayan, before we respond to Osmond, we will not skip corner to do who wants to know about folic acid and where to access it. This folic acid for women, is it prescribed by you doctors, or somebody can walk somewhere and get it?
It's an over-the-counter medication. You can walk to any pharmaceutical shop and get it.
It's okay. So Anyway, that's okay. Connor, I believe you are listening. And for Sunday Akbar, maybe we should talk on his from the point of view of stress management. Maybe Dr. Dogoh. Sunday Akbar was wondering where the place of forgiveness, keeping malice, how it affects the health of people.
Okay.
I was making excuse that you are not religious leaders and you may not be preaching forgiveness, but
we are.
help us.
We are family physicians.
Now let me give a context.
All right.
We are. If you look at the guests in the studio, our approach to patient care is a very holistic one.
Yes.
We x-ray their economic, social, medical, and spiritual life.
Yes.
The context of their families, and the community at large. So that is also part of our domain. Now, just to say that, we know we didn't get to discuss a lot about stress and mental health issues. But you see, this is a very critical factor in stress management and in mental health. Now, because you discover that there are a lot of people of bitterness, they are not able to forgive, somebody has really hurt them, and that brings a lot of emotional stress. So that is also a form of stress, and it's like diabetes. So this kind of mental stress can also predispose to that. Now, that can also, predispose to mental issues. So we recommend that forgiveness. I actually agree with him that forgiveness is a major tip that will help in healthy living. So if you are out there, you are listening to us, and there are people that have offended you and you find it very difficult to let go, we recommend that you forgive them. We recommend that you live in peace. I'm a Christian, and the Bible says you should live in peace with all men. In fact, the Bible encourages us to forgive as we ourselves have been forgiven to our neighbors. Of course, offenses will always arise, but it behoves on us to be able to let go and to move on, because this can become a major setback in our progress. Now, before you move, just to say something, so that we don't forget,
yes.
There was somebody that asked about the last patient, because he specifically said he has some children in the house.
That's the same tied to corner.
Exactly. So, yes, if your child has missed vaccination, the child can actually be revaccinated. So what he needs to do is to take those children to the hospital. They will evaluate them, know their ages, know the vaccinations that they have missed, and then they will know what to do appropriately. Because, for instance, things like hepatitis, you can vaccinate at any age. Things like human papillomavirus is from the age of 9. I think he mentioned 5 and 7 or something like that. So meningitis is there, measles is there, yellow fever, pneumococcal. So there are a lot of vaccines that even the pentavalent vaccine, there are a lot of things that these children can still benefit from. So it is not too late. As early as he can or as soon as he can, he should go to the hospital. He can come to Federal Medical Center here, and then we can assist him with that. So that is very critical. And then the last person talked about the issue of herbs for hepatitis. We don't practice herbal medicine. However, we don't completely rubbish what they do. We believe that some of these herbs are good ingredients for the drugs that we produce. Nonetheless, I've not come across any scientific, we are scientists first of all, scientific articles that have given us a cure for hepatitis using herbs. And just to also add that some of these herbs can actually cause more damage than they are anticipated to bring benefits. So those that use herbs to treat, we want to encourage them we want to admonish them to be careful, because when you go using some of these herbs, you may not be able to know the amount of ingredients that are inside, and that can actually lead to some more problems, especially when you are dealing with the liver and the kidneys. So just to sound a note of caution on that. Thank you.
All right, that caution is well established. Now, Dr. Apande, you want Nongu. Nongu wants to know whether a distant partner could be a predisposing factor to prostate cancer.
It's okay. Firstly, I will add something to the use of herbs and hepatitis.
Yes.
In medicine now, there is another area of medicine that we call complementary and shade, what has been studied and what someone just made from their kitchen in their locality and is selling. we have some complementary and alternative medicine practices, but this in the main medical profession, some of us also are aware of some of the things that should be done. So it's better for the doctor to be able to differentiate. This has been studied scientifically and is proven to help both our natural ways of life that people have been reactivated now to use to cure some ailments. So it's better to always be able to distinguish between complementary and alternative methods that are being used now in the medical profession. So to answer the person that want to know whether developing a prostate problem can stem from distance from your partner. Well, the development of either benign prostatic hyperplasia, that is the swelling of the prostate, and cancer is not related to absence of partner, not to my knowledge, or sexual activity, not to my knowledge, because it happens both across celibate people and non-celibate alike. So some people are married to more than one partner, but they still come down. Let me say some men are married to more than one wife, but they still come down with prostate, either BPH, that benign prostatic hyperplasia, or prostate cancer. So I have not seen any studies that support any. I've heard from social media people doing things on TikTok and saying those kind of things, but it is not proven.
All right. Now, Dr. Gbayan, we will not gloss over the fact that in family relationships, sexual intercourse is important. What is the place of good sex between couples to promote healthy living?
Okay. Good sexual intercourse between couple, just as he said, the first presenter said, these are sexual intercourse, apart from the fact that it's for fun and producing for fertility, it has a way of what's what I'm looking for a word. It has a way of improving the unity.
The bond, maybe.
Thank you. It has a way of improving the bond between the couple, and then it increases the following sexual intercourse. Both parties tends to be happier, and as you're happier, your productivity also increases. Your communion with each other also increases. Because you're in good terms, the way you reason out things is better. The way you express, is a means of reducing stress. Let me just summarize it that way. Sexual intercourse improves harmony between couple. It improves our productivity as an individual, and then it lessens the stress. You go about your usual activity, you're so stressed out, but you come back with this, you come back meeting your partner, you had nice time together, and it eases you of the stress that you accumulated in the course of the day. So you become rejuvenated, sort of, and then the next day you're good again to begin your next day. So just to put in a word for that.
Maybe before you put a word different to what we're talking about, we should add that this lecture is for only married people.
Yes.
All right.
Very important, very important.
Yes, thank you for that. Thank you very much. Okay, in as much as there are so many studies have been going on concerning this sexual, there has been scientific studies that are trying to prove that a man's sexual activity has a way of improving or preventing prostate cancer. I wouldn't want to just throw that out. Maybe there's some element of truth, but we have not come to a tentative conclusion. So, but the summary of this is couples should have regular sexual intercourse. It helps not just with the fact that you're easing yourself, that's from the man now, and preventing prostate enlargement, but also for companionship and for as a means of reducing stress.
All right. Well, we're fast running out of time already, Dr. Dogoh. We are in a weather condition where respiratory conditions are common. How can people prevent allergies and generally manage this weather of harmattan we're getting into? But before you speak to that, an engagement, because we have had many persons waiting on the line, engage one person and then we'll conclude. Good morning.
Good morning.
Thank you.
Please, can I have the doctor's number in the hospital so that when I come, I will see him or talk to him?
Okay, this sounds like Moses again.
Yes, it's me.
Okay. Moses, thank you for calling in. The doctors are known with address. Maybe when we conclude, we'll call out their names again. If you get to the head facility and you ask, you're looking for so and so person, you could be directed on where to meet the person.
Okay, thank you very much.
Thank you. That will be the last call we'll take. We have had, so Dr. Dogoh.
Yes, sir.
On to you now. This will be brief because we are already concluding. If you can speak on that in 1 minute, that will be fine.
Okay, so like you rightly noted, this is a period where we are prone to a lot of respiratory tract infections because of the surroundings clean and free of dust, especially for those of us that have rugs in our houses or foot mats and all that. They should be cleaned regularly because this dust can be a major source of allergies and respiratory tract infections. Also, try to close your windows when you are going out of the house to prevent, the dust from coming into the surrounding. Then if you are going to go to areas that are very dusty, use a face mask. That can also help. And then we encourage everyone to stay hydrated. The weather this period is quite dry, so we encourage you to drink as much fluid as you can in various sources. It could be from fruit juice, it could be from water, but of course water is easy to come by, so we encourage people to stay hydrated. We encourage you to get adequate sleep as well. And then also we encourage appropriate exercise. So these are some of the few things that can help. And if you develop any cough, if you have any fevers, any problems, please come to the hospital and those will be appropriately addressed.
Talking about cough here, chipping a word briefly on tuberculosis and ways of its prevention.
Okay, well, it's basically tuberculosis is a mycobacterial infection.
Yes.
It's an infection caused by Mycobacteria tuberculosis. So drugs is not as common as we used to see it in those days, and of course it is. And then the anti-tuberculous drugs that have been made available free, that has really helped with the amount of cases that we're seeing. But to encourage, if you find yourself cough, so that you don't transfer this illness or this disease condition to others around you, because it's a communicable disease. So this is also one of the things that is prevented in the immunization schedule. And that's one of the reasons why we encourage people to ensure that their children are vaccinated. But for the tuberculosis, if you find yourself coughing, you find yourself having a low-grade fever, please visit the hospital. Let us evaluate, let us investigate. If it is not tuberculosis, we praise God. If it is tuberculosis, we will treat, and you'll be good, you'll be okay by God's grace.
Dr. Gbayan, there are certain maybe infectious disease condition like HIV and AIDS. Let's speak briefly about ways of preventing sexually transmitted infections.
Okay, sexually transmitted.
And that will be your concluding thoughts.
Okay, thank you very much. Sexually transmitted infection, the best method of prevention is abstinence. But if you cannot abstain, make sure you engage in very safe sexual practices. use barrier method, use condoms if you must engage in sexual intercourse, and then you should be faithful partner. Then you should use protection condom. And then if for any reason, let's do regular checkup, just as we said earlier. We can be checking, testing for these sexual transmitted diseases, like the common ones we have: HIV, hepatitis B and C, human papilloma virus are sexually transmitted infections, and they can be screened for lockingly. So let's be doing a routine checkup if you are a high-risk individual. So if it will be detected early and you will be commenced on treatment.
Dr. Apande, speak to us briefly about arthritis and ways of preventing it.
Okay, arthritis is a condition of the musculoskeletal system that develop as a result of wear and tear, so to say, in the joints of individuals, especially as they age. So ways of preventing it is by maintaining a regular moderate exercise to strengthen your joints, eating healthy to replenish your nutrients that help to rebuild the surfaces of these joints, so that you not, and maintain adequate hydration, always drinking the right amount of water. Usually an adult is supposed to take between, in terms of sachet water, at least 4 to 6 per day. So when you rehydrate your body, and then you eat properly, the body have a way of rebuilding wear and tear. And then regular exercise, of course, will maintain your posture. And then a weight management. Some people who are overweight, the weight of their body is carried by the skeletal system, and these joint spaces are reduced by force of the weight.
All right.
And so maintaining good weight also is a way of preventing arthritis.
Dr. Dogoh, you are the president, so I will allow you just 10 seconds of your parting words and what your annual general meeting this year holds at the Association of Resident Doctors, Federal Medical Center. This will be in 10 seconds, please.
Okay, thank you very much. Thank you very much. We want to first of all appreciate the station, the Agig radio station, that has given us this opportunity to carry out this program. We are glad that we can, give back to the society by way of creating health awareness on healthy living, and we hope to make this a consistent program that will be running with time. We also want to appreciate the sponsor of the program. It was actually sponsored, like I said earlier, by one of our teachers and a life member. He was the former president of our association, though a consultant now, obstetrician, Dr. Michael Ejiku. He's the MD of the Foundation Hospital. He was a sponsor. Now, this year's annual general meeting is titled, the theme of the meeting this year is exploring opportunities for medical practitioners in the face of a challenging economy. And then we have a sub-theme titled Digital Medical Consultation, the Ethical Implication. We discovered that a lot of individuals like consulting us on the phone, as we saw even in the studio today. So this has a lot of ethical implications, and we want to x-ray some of those things in our meeting.
All right.
We are inviting everyone to come and participate in this meeting.
This is where we draw curtains on today's edition of Perspectives, which focus on sensitization on healthy living. The edition sponsored by the Association of Resident Doctors at the Federal Medical Center, Makurdi. Dr. Fanen Dogoh is a senior registrar in family medicine and president of the Association of Resident Doctors at the Federal Medical Center, Makurdi. He is a deputy caucus leader, North Central Caucus of the National Association of Resident Doctors. Thank you very much, Dr. Dogoh, for leading your team to the program.
Thank you.
Dr. Tesu Apande is a senior registrar in family medicine at the Federal Medical Center, Makurdi. He also joined us. We appreciate you, Dr. Apande.
Thank you.
Dr. Esther Gbayan, the woman that has been blessed amongst women and amongst men in the studios. She is a registrar in Okami.
Thank you.
Dear listener, that's our program today. Join us on Friday for a fresh edition to focus on another issue. My name is Nathaniel Nongu. Have yourself a great Wednesday ahead, and please stay healthy and watch out for your